This is the demonstration for medication administration installations. Let me remind you that you need to verify your physician's orders. Check that with the MAR, of course, before you go to administer the medications. And then when you are preparing your medications, you need to check those at least 3 times before you administer them to your patient. I've gone over that in the previous medication administration videos, so I'm not going to go into great detail on it here. We have several different types of installations to go over today. We have ophthalmic medications, otic medications, nasal medications, and inhalation medications. Alright, so first we're going to look at ophthalmic medications. You have 2 different types. You have drops for the eyes and you have ointment for the eyes. First we'll look at drops. Okay, you want to apply gloves for this procedure. Wash your hands first, of course, and then apply your gloves. Of course, you want to, when you enter the patient's room, you always knock for entry and then clean your hands, sanitize your hands or wash them. Identify yourself, identify your patient, and explain the procedure. And we've gone over that in detail in the previous videos also. So tell me your name, sir, and I'm going to take a look at your armband. And you are checking the armband and comparing it to the MAR so that you can ensure by 2 identifiers. Usually it's going to be name and medical record number. So that checks out with my MAR. Alright, sir, I have some medication for you. The first kind is some drops for your eyes. So I'm going to give you a tissue in case we have a little bit of drainage, so you can hold on to that. And you want your patient, they can be either sitting up or lying down, so the head of the bed elevated this much is going to be fine. Sir, I need you to, while I'm getting ready to administer these drops, I need you to look at the ceiling and pick a spot up there and just focus on that while we do these drops. All right, you want to keep the lid of the drops sterile, so if you can hold it, that would be good. Okay, then you're going to expose the conjunctival sac, and you just pull down on the lower conjunctiva there, and you want to steady it with your hand so that you don't poke them in the eye, and then instill the drops. Recap, keeping the tip sterile and the lid sterile. Of course, your patient can use the tissue if they need to. They don't need to rub their eye, but they can pat it or dab at it. Alright, for ophthalmic ointment, procedure is very, very similar. Okay, again, you want to provide a tissue for your patient. Instruct them to pick a focal point on the ceiling and focus on that. You're going to keep the tip sterile again and hold on to the lid. Okay, expose your conjunctival sac. And you want to apply the ointment from the inner canthus to the outer canthus. So, alright, sir, if you'll focus on the ceiling, apply it, and then just give a little twist to break the stream of ointment. Do not touch the tip to your patient's eye, and then recap. Next is otic medications. So that's another word for that is going to be eardrops. Again, you're going to prepare your patient. Lying down and lying on their side is going to be the best position. They can just turn to the side if it's difficult for them to lie on their side. So I'm going to lower the head of the bed. Alright, these drops are to be instilled into the left ear. Sorry, if you'll turn your head to the right for me. Before you administer ear drops, you want to straighten the auditory canal. And for an adult patient, you take the pinna of the ear and you pull it up and back. So I'm going to take the lid off of my drops. Hold that again. I'm going to straighten my auditory canal by pulling it up and back instill the drops and let them flow down the side of the canal. Replace your cap. Sir, I need you to maintain that position for about 5 minutes, please, before you turn your head back. Okay, I'm going to raise the head back up now. And lower my side rail. Next is nasal medications. So you want to prepare your patient, position them, 2 different types. There can be nose drops or a nose spray. First of all, you want to have your patient blow their nose. Sir, if you'll blow your nose for me, please. Have them do that. Alright, again, they can be flat or they can be sitting up. And they just need to have their head positioned back. So I'm going to remove the pillow so that they can have their nose back. This will be our nose drops. We want to tilt the head back, expose the nares, and instill the drops just inside the nares. So you can raise it up, a drop there, and then a drop there, just inside the nares. For spray, we'll say there's supposed to be 1 spray into each nostril. So you have the patient close the opposite nostril, place this inside the nostril, and have them take a slow deep breath, and while they're inhaling, you're going to administer. And then you occlude the opposite side and repeat there. Next is the inhalation methods for administering medication. First, we have a metered dose inhaler. Okay, you have your canister, and then you have your plastic inhalation portion. You want to insert that, remove your cap, shake well before use. And most instances now, we are incorporating the use of a spacer that attaches this end. And then this will be the piece that goes into the patient's mouth. Okay, you want to place this into the patient's mouth, have them take a deep breath in and blow it out, and then you want to administer the medication. Okay, so, alright sir, take a deep breath in for me, and then breathe out. And I'm going to place this in your mouth, and I want you to take a deep breath in while I spray the medicine, and then please hold your breath for 5 to 10 seconds. After that time, I'm going to let you exhale, and I want you to exhale through pursed lips, kind of like you're blowing out candles, like that. All right, take a deep breath for me, in and out. All right, now if you'll inhale while I depress the canister, hold that for 5 to 10 seconds, and then exhale through pursed lips. If a second puff is ordered, you want to instruct the patient to wait anywhere from 1 to 5 minutes before doing the second puff. Alright, then take this apart, rinse your canister, and let it air dry. Okay. This is a dry powder inhaler. It's not on your medication, your validation sheet, but I just wanted you to see it. There's a couple of different types of these. This one is pre-loaded, so you don't have to insert anything into it. That opens it. This is the mouthpiece, and then you instruct the patient to hold it in their mouth and take a deep breath in, and they're pulling on this to suck the powder into their lungs. Some other types, you have to insert a little capsule and then crush that, and then it gets crush the small capsule, and the instructions are the same. Alright, next is a small volume nebulizer. Again, you prepare your patient. This is a respiratory treatment. You may have heard this referred to, and your patient can be sitting up or lying down, whatever is comfortable for them. Alright, first we're going to prepare a medication. There's a little bit of assembly that's required for this. Most of the times in the healthcare setting, your respiratory therapy department are the ones who administer the respiratory treatments and the small volume nebulizer. Okay, this part here is for the medication. Just unscrew this. This is our medication. It comes pre-filled in a plastic container. You just twist the top off, squirt the medication. Usually it needs to be mixed with either sterile saline or sterile water. This is normal saline. I'm going to twist that off, insert that in, and then reattach my cap. Swirl that around to mix it. Okay. Then you have your tubing that attaches to your cup. And then this attaches to our oxygen. And you want to turn your oxygen on. Our T piece. And attach your tubing. And the other side we attach the mouthpiece. Okay. There should be a fine mist coming out of the back of this once you have your oxygen turned on and it mixes with the medication. We're going to place the mouthpiece in the patient's mouth and have them to grasp it securely with their teeth and to close their lips around it. And then you want to instruct them how to do it. So, sir, if you would, I want you to inhale slowly through your mouth and then breathe out through your nose. Each breath, try to hold it for 5 to 10 seconds. And you're going to continue until all of the medication is out of the little canister. Okay. When you finish, you want to disassemble the equipment. Rinse it with warm water and allow it to air dry. And turn off your oxygen source. Okay, as with any medication, you want to document after you have administered the medicine, whether it be on the MAR or in your computerized MAR with your computerized system.